Anxiety and depression, the etiology of both pathological conditions and the signs, symptoms, treatment, and consequences. Etiology, a cause or origin, specifically the cause of a disease or abnormal condition. A branch of knowledge concerned with causes, specifically a branch of medical science concerned with the causes and origins of diseases. Anxiety, a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. A nervous disorder, characterized by a state of excessive uneasiness and apprehension, typically with compulsive behavior or panic attacks. Depression, feelings of severe despondency and dejection, a mood disorder that causes persistent feelings of sadness and loss of interest. Causes of anxiety and depression are chronic stress and life-changing events such as medical illness, personal or financial problems, death or loss, substance abuse, family history, or genetics. People with either condition may react indirectly to stress in multiple ways throughout the body. These areas can be affected. Your skin. You'll have breakouts and sensitivity. Your heart. Stress can raise blood pressure, blood sugar, and cause arrhythmia. Your stomach. Issues can arise like GERD, IBD, IBS, food allergies, and ulcers. Your intestines. Stress can decrease the nutrient absorption and decrease oxygenation. Pancreas. There can be an increase in blood pressure, breathing, heart rate, and blood sugar. Reproductive system. Stress can decrease the fertility and your sex drive. Immune system. Stress can cause corticosteroids to suppress the effectiveness of the immune system by lowering lymphocytes in the blood. Your muscles and joints. Stress can cause chronic aches and pains. When under more stress than usual, the body creates more of the hormone cortisol. Cortisol then affects the function of the hippocampus, the part of the brain responsible for converting short-term memories into long-term memories. This interferes with the neurotransmitter's activities and prevents normal memory function. This is where PTSD plays a part, as the neurotransmitters signal the hippocampus to store an emotionally loaded experience in the long-term memory. The physical symptoms of anxiety are increased heart rate and heart palpitations, increased blood pressure, dry throat, dry mouth, making it hard to swallow, cool, clammy, sweaty skin, an upset stomach. You can have digestive activity temporarily shut down due to metabolic system going awry. Nausea and dizziness, be short of breath, some insomnia, like you can't shut your brain off, and muscle tension. The physical symptoms of depression are fatigue, decreased energy, insomnia or excessive sleeping, irritability, loss of appetite or excessive eating, chronic and persistent pain, headaches, cramps, and digestive problems. Here the blue shows the common symptoms, both in depression and anxiety. Symptoms like fear, panic, apprehension, panic attacks, chronic pain, GI complaints, excessive worry, agitation, difficulty concentrating, and sleep disturbances. Often, people have symptoms that do not show. They do not look physically sick. This is a quote I took from an anxiety Facebook page. Having anxiety and depression is like being scared and tired at the same time. It's the fear of failure, but no urge to be productive. It's wanting friends but hating socializing. It's wanting to be alone but not wanting to be lonely. It's caring about everything, then caring about nothing. It's feeling everything at once, then feeling paralyzingly numb. Treatment. The first step to treating anxiety and depression is admitting there is something wrong. Confiding in someone you trust makes the problem real. You can often step away from it and see it for the first time. Once a confidant has been found, a trusted physician is the next step. That physician can check physical symptoms to determine nothing else is to blame, can refer to a psychiatrist or counselor, and can prescribe medications. Therapy. There are multiple forms of therapy available. Sometimes using more than one form of therapy at the same time helps. There's cognitive behavioral therapy, which focuses on identifying, understanding, and changing thinking and behavior patterns. Exposure therapy, a process in reducing fear and anxiety responses. Acceptance and commitment therapy uses strategies of acceptance and mindfulness, along with commitment and behavior change, as a way to cope with unwanted thoughts, feelings, and sensations. Dialectical behavioral therapy combines acceptance and change. Interpersonal therapy, short-term supportive psychotherapy that addresses interpersonal issues in depression in adults, adolescents, and older adults. Eye movement desensitization and reprocessing therapy helps a person see disturbing material in a less distressing way. Although highly advertised, medications should not be the only source of treatment. Many forms of antidepressants and anti-anxiety medications exist. However, that doesn't mean they cure the underlying issue. Everyone reacts differently. It may mean trying different medications before finding the right one. Understanding. Along with therapy and medication, understanding the disorder helps. The more you know about something and understand it, the easier it is to accept it, deal with it, and adapt to it. Lifestyle changes can drastically help. Exercise, nutrition, sleep, social support, and stress reduction are all changes proven to ease depression and anxiety. The consequences of either disorder will take its toll, not only on the person suffering, but on loved ones, jobs, co-workers, friends, your love life, and social life. They can have a lack of social activity. A person can have gastrointestinal, respiratory, and heart-related problems. Anxiety and depression can cause poor performance at school and or work. People can become irritable and have a lack of understanding from family and friends. The most severe consequence is a possibility of suicide because the person can't cope. In conclusion, anxiety and depression are mental disorders that affect more than 40 million adults. Many suffer from both. They are diseases that have no cures and yet can easily be treated and kept under control with the help of therapy, medications, and or alternative medicine. Signs and symptoms of anxiety and depression can be hard to spot, especially since they mask as other conditions. People suffering from either disorder do not choose to do it to themselves. They know something is wrong in the way they think and feel, yet cannot control the thoughts or feelings. Understanding the condition and having their loved ones understand it makes it that much more acceptable.